Hi, so we're Brampton and Caledon Health Coalition. We're part of Ontario Health Coalition, and our mission and mandate is to protect and improve public health care. We are so happy to have this opportunity to work with Unifor and Peel Regional Labour Council to get people's stories, their questions, their opinions on public health care, how things have been going, what they would change. Anything that you want to say, you're welcome to say. We have some lovely co-hosts today, so we have a panel of wonderful people, and we will be taking submissions from you guys. They will be commenting on them briefly, but we really want the focus to be listening. My name is Janine Herman-McLeod, by the way. I'm the co-chair. So this is my first big event like this, so I really appreciate everyone for coming and for your patience as we get everything ready.
Brampton and Caledon are a part of the treaty lands and territory of the Mississaugas of the Credit. For thousands of years, Indigenous peoples inhabited and cared for this land and continue to do so today. In particular, we acknowledge the territory of the Anishinaabe, Huron-Wendat, Haudenosaunee, and Ojibwe/Chippewa peoples, the land that is home to the Métis, and most recently, the territory of the Mississaugas of the Credit First Nation, who are direct descendants of the Mississaugas of the Credit. We are committed to developing and maintaining mutually beneficial, respectful, growing relationships with
our local First Nations communities and contributing to the challenging of colonial structures and attitudes, the care and defense of their people, and remaining humble in our amplification, listening, and centering of Indigenous voices. So if anyone would like to check out the Indigenous Network, they are a really great people, a great group of people who work on advancing the rights and advancing the health and many other things of Indigenous people in Peel. They used to be Peel Aboriginal Network, PAN, if you might recognize that name. So they have a healthy living initiative that's really awesome. And they have a garden named Wasanabin that has Indigenous youth gardening, so that's really great. Thank you, everyone.
Thank you, Janine. One thing that I should be saying is that Janine and the Brampton Caledon Health Coalition has really only been formed in the last 8 months.
We were Peel before.
Yes.
Starting in February.
Right.
And we officially voted in August to become Brampton Caledon.
Great. So we're going to be hearing more about the dissolution of Peel Region and what potentially could be happening. And that's why we do have Dave Wakely, the president of the Paramedics Union of Peel, with us tonight. But I just wanted to introduce the other panelists that we do have with us. So Dave is, like I said, Dave Wakely is from the Peel Paramedics Peel Paramedics Union in Peel. We have Remy, thank you, from the MOYO.
It's Moyo.
Moyo.
Moyo is a word.
Moyo. Sorry, it is, okay.
Yes.
And she is the Community Engagement Manager. And then we have Amit Singh, who is a frontline worker. He is a practicing nurse in Brampton, and very, very up to date on the current threats and the current crisis that we're seeing in the healthcare system in Brampton and Peel. And we also have Josh Coles, who is the Unifor National Director for Political Action and Membership Mobilization. But, and by the way, I'm Jim McDowell. I'm the chair of the co-chair of the Unifor 1285 Union Politics Committee.
We represent about 950 paramedics and logistics technicians that make sure that our trucks are ready to go, and the paramedics are obviously in the trucks to get to the calls 24 hours a day, 7 days a week, 365 days a year. In the past 20 years, since the provincial download and Peel taking us on, we've become a world leader in pre-hospital research. So now if you have a cardiac arrest anywhere in Europe and Australia, the research that was done right here in Peel has changed how your cardiac arrest is going to be managed pre-hospitally, and in some cases in hospital. That's the strength of the system that we have here. There was a 5 or 6 month period where if you had a heart attack at the corner of Main and Queen, we could get you into the operating room faster than if you walked in the front doors of Brampton Civic Hospital. So it's an absolutely world-class system that we've managed to develop over time, and we've managed to build on the heels of what was another divestment and merger that happened. And it's taken us a long time to get there. And there's a lot of people that have suffered in the meantime while we've been building this system, and there's a lot of people that stand to suffer through dissolution. I am an advanced care paramedic here at the Region of Peel, and I've been one since 2005. I started the Region in 2003. So this is all very real lived experience to me. I'm still on the road, I'm still waiting in hallways for my patients to get bed, I'm still responding to calls out to the community. I want to start today talking about Peel Dissolution and the Peel Dissolution Act and how that is being administered, or how it's looking from our perspective right now. The Peel Dissolution Act was passed in May of this year, and all it really says is, hey, we're going to dissolve the Region of Peel effective January 1, 2025. It's just going to disappear. And we're going to appoint 5 people, and they're going to figure it out. Good luck. So here we are several months later, and these 5 people are operating in secret. No one knows what they're talking about, to whom they're talking. The politicians have largely been excluded from the process, and staff are all bound to secrecy. So there's no public accountability to the work that they're doing. We're left to operate in the shadows, to try and find out what we can through rumor and innuendo, and people who are actually breaking the rules to tell us what's going on. The government told us this was a way to build houses. I don't know about you, but breaking healthcare, breaking social services, breaking a paramedic service doesn't build houses. We all know that's true. At present, it looks like the transition board is going to be recommending that Peel Paramedic Services be broken in 3. So we'll have a Caledon Paramedic Service, a Mississauga Paramedic Service, and a Brampton Paramedic Service. What I'm hearing is this transition board is obsessed with infrastructure. They're taking a look at a map, and they're taking a look at our balance sheets and going, okay, well, they've got 100 ambulances, so we'll give 60 to Mississauga, we'll give like 36 to Brampton, and then we'll give 4 to Caledon, and we're good, right? Where are the buildings? Okay, we'll give those buildings to those cities. What they've totally forgotten about is the health human resources that are needed to operate the services and to provide the services to the residents of the Region of Peel. Currently in Ontario, there's over 1,000 open paramedic jobs because after COVID, people stopped wanting to be paramedics because it's unsafe and scary, and they didn't really solve that during COVID. So our numbers have dwindled, and the education system hasn't been able to keep up. We haven't been able to recruit new students to come into the profession. So as we sit here today, there's 1,000 open jobs. Every paramedic in Peel could get a job somewhere that's not Peel today. Last year when we tried to hire, we wanted to hire 100 paramedics. At the end of the process, we could only find 62 qualified applicants to agree to come work for us, and most of those, despite being offered full-time hours, only wanted part-time hours. So health human resources is a real problem, and I'm sure you're going to hear from my friend that it is not only paramedics, but our paramedics are now in a process where they don't know what's going to happen to them January 1, 2025. They're being told, oh, we'll be taken care of. But when you look at the law, all the law says is that your employer, your collective agreement, your benefits, your earned vacation, the job that you've been loyal to for 20, 30 years in some cases, is not going to be there. But trust us. I don't know if anyone's looked back in the history of trusting the government, but I don't trust them. And neither do my members, and they're now at a point where they're starting to look for other jobs. So when I started talking to politicians about how bad this was going to be, ooh, don't look back there, how bad this was going to be, I always said, no, this is going to be a problem January 1st, 2025, because you assume we're all going to come work for an employer. And that's a wrong assumption. That only 125 of my nearly 1,000 members live inside the region of Peel. They're going to find a place where the commute isn't quite so bad, where the cost of living isn't quite so bad. And in January 1st, 2025, we're going to have a problem. Well, I was wrong. I was so wrong. Because the way paramedics get hired in Ontario, the hiring process starts in January, and new applicants are brought on in June. So what I was wrong about was the date. We don't have till January 1st, 2025 to solve this crisis. We have till February 2024 to get in front of it, or our paramedics are gone. We will not be able to deliver service to our community past July. They're going to get other jobs, they're going to go, and it's all because of the instability created by the Peel Dissolution Act. It's going to create a crisis in our system, and it fits with the neoliberal pattern that we've seen time and time again. Underfund, abuse public service, create a crisis in public service. And then what comes next? Oh, come on, you go. Privatization. There's an alarming growth in private management contracts in Ontario EMS services. For years, there was only a single private EMS operator that operated a small service up north. What we saw was years and years of lobbying. We saw the president of Medivy be on Doug Ford's healthcare table. He was going to tell him how to fix it. We've seen them sponsor extravagant dinners and brunches at the Association of Municipalities Ontario. And they're finally starting to get a foothold. Not through the traditional way of taking over the whole service. No. That's hard and might actually cost them money. They have a new plan. Their new plan is to contract management to our services. So they hire, in often cases, just the CEO or the chief under a private management contract. And then the private company gets to administer the public resources for profit. I've spoken to union leaders in services that have recently had this happen, and they report that they have publicly funded supervisors that are being paid by the county, doing work to develop private property, like private intellectual property on how to run an ambulance service for Medivy. So this is just another way of privatizing wealth and taking ultimately what is public money and funneling it into private pockets. So what can you do? How can you help us today? We're asking everybody to email peeltransitionboard@ontario.ca and ask them to keep their paramedic service together. Tell them that we have a world-leading paramedic service. Tell them that our members want to continue to deliver world-leading care to the residents of the region of Peel. Tell them that you're scared of what happens if we don't have enough paramedics to respond to 911 when the phone rings. Thank you all for your time.
Thank you, Dave. I don't know what to say to that. Could you imagine what Brampton, what Caledon, and what Mississauga would look like if we don't have the ability to call 911 and have an ambulance come to our home and take us to the hospital? That is a possibility. And it's going to be something that we could potentially see within a year. So please keep this in mind, that the Ford government has been seeking the slow creep, the slow privatization over not just a year. This has been happening now since Mike Harris. We've been seeing this happening now for over almost 20 years. So we have to keep that in mind too, that they will cut and slice out major parts of our healthcare system and privatize it. We're seeing this with long-term care. We could potentially be seeing this with paramedic services. And to be quite honest with you, I've been talking to a lot of people in the healthcare system, and this will probably be used as a model, a test model, on how to privatize the paramedic services in a large community. And this is what we're seeing right now. But thank you so much for this, Dave. It's been very enlightening, and to be quite honest with you, very, very scary.
Hello everybody, my name is Mira Mohammed. I go by she, her pronouns, and I am the Community Engagement Manager at Moyo Health and Community Services. So many of you may not know, but our organization was actually founded 30 years ago this year. So we are celebrating 30 years of being in the community. And our actual organization started off with 3 public health nurses that found a need in the community. There were many people who were living with HIV in the community, specifically in Brampton and Mississauga, that were not having access to HIV treatment and care. And this is what led to the formation of Moyo Health Community Services. So a little bit about me and some of the work that I do. So previous to being the Community Engagement Manager at Moyo, I was a support manager. And in that role, I got to see firsthand what it's like to not only work with, but also hear the lived experiences of people living with HIV in the community. And some of the things that I heard and some of the things that I saw were not surprising, but also surprising that it's still going on in 2023. Some of the things that we've been specifically struggling with is we have a PrEP clinic. So PrEP stands for pre-exposure prophylaxis, and this is a medication that you can take that will actually prevent HIV. And our clinic has been open for a little over a year now, and it has turned into one of the only clinics in the Peel region that is providing sexual health at a low barrier and cost-free method. So since the beginning of this clinic, we saw that there wasn't much traction, but fast forward to now, we're seeing that our clinic is every single week overbooked to the point that we are having to reschedule or having to only have our appointments or our bookings by appointment only. And this has created a major need in the community for sexual health services that were not previously available. So one thing else that I've noticed in my short time of working at Moyo is that we have an aging physician population in the Peel region. One thing that we've come across again and again is that we have people who are seeking these medical services, but once they are going to connect with these HIV specialists and the primary care physicians, they are not having, they are either full or they are having to travel to Toronto and River City to receive some of those services, especially HIV specialists. I think there's currently only one that is serving the Peel region. All of our other clients have to be sent to Toronto. So seeing these, some of these disparities that are happening within our PrEP clinic and seeing that it is a major need, we have again and again applied for funding to continue some of the work that we're open for our clinic. So we're only currently open 1 day a week for 3 hours, and that is not nearly enough. In this past year, sexual health clinics have become the #1 need, especially in the Peel region, because we are not providing access or low barrier and cost-free care. And looking for funding for some of these projects has led to very serious ramifications, including higher rates of HIV, including more people living with HIV and not getting treatment, and which ultimately leads to the transmission of HIV. Now, does anybody know what the average cost of HIV medications are for 1 month? Please feel free to yell it out. So I heard 7,000. Okay. Anything else? I heard
900.
1,500. Okay, you guys are very close. So it's about $1,100 to $1,600 for a month, and that's for just 1 pill a day. So what we're finding is that, I don't know about you, Belle, but I probably could not afford to pay for that every single month. And so a lot of our clients are having to go on ODSP so that they can afford their medications, which leads to another cycle of limited employment, which leads to more social determinants of health, which ultimately impedes their health and leads to poorer health in our communities. So these are some of the things that we've kind of been seeing in our community, and although we have asked for provincial funding time and time again, we're only met with short-term funding for short-term projects, and we're often having to go to other organizations and pharmaceutical companies to kind of fund these projects. It's one of the kind of upsetting things that I think I've seen throughout this work is that we are having to go to the pharmaceutical companies to kind of get affordable care for our clients. So since these medications are so expensive and Trillium Health drug plan can only cover so much of it, we're often having to call on behalf of our clients, we're having to call these drug companies to offer subsidized pricing to these medications. So this is something that has gone on for a very long time and continues to have a very real impact on everybody's health, because HIV, although it seems like it is not a very present and urgent matter, it still very much is. And actually in our community, specifically with the Black community, we are seeing levels of up to 60% of new HIV cases per year. So some of the things that we have been able to do to mitigate these is including things like our PrEP clinic, is including things like low barrier and cost-free care, so that some of our clients can get these medications in their hand and reduce the transmission of HIV. And so funding to projects like our PrEP clinic will provide more people access to health that is low barrier and cost-free, as well as culturally sensitive care. Thank you.
Thank you so much for that. Like I said, we're seeing potentially what potentially will be happening with your service in regards to the dissolution of the Peel region. I mean, it's terrible to see what potentially could be happening with the services that we're currently using in Peel region, because I know there's over 100 agencies that will be affected by the dissolution, and it's something that most people aren't even aware of. How is that going to be affecting not just healthcare services, but almost every service that is provided by Peel region? It will affect not just that, but it will affect everybody living in the Peel region in some way or the other. But then again, thank you so much for this. Can I ask Amit Singh to come up and talk to us from the perspective of a frontline worker in the healthcare system? Thank you.
Thank you, everyone. My name is Amit Singh. I am a registered nurse that is working in the community, has the privilege of working with wonderful people, Peel paramedics being colleagues of mine in times of crisis, liaise with us. And when I look up right now in front of me, I see future patients, I see present patients, and people that are sitting waiting for answers. The social promise that was made to us is broken. The social promise of we pay our taxes, there is equity, and there is dignity in our care, that is gone. And as my colleague here pointed out, the intellectual property of the public trust, which is our education system, our ability to train clinicians, their ideas, all of that is now leading to a private model. A private model that does not respect the care needs that we have, and their only interest is to make profit. When we see that system being implemented, we lack the sincere hope that our politicians are speaking for us. We've somehow acknowledged this reality that things are going to go private and we're okay with it. Well, I'm sitting in a room full of people that are standing up to that, or patiently waiting to have their turn to speak up and say, that is not something that we stand for here today. And talking about complexities and pulling on heartstrings, I think we're past that stage now. We're seeing the realities of it. you and I both, if we wait in an ER hospital, it doesn't matter where in the province, we're gracious enough and the circumstances here are kind enough to us that we don't have our ER schooling done. I'm thinking about all the northern communities, all the small towns, all over this province, where if you think you have a crisis, you have a loved one, you know there's a hospital nearby, you go there and you find out that ER is closed. That's not something we expect with the level of generational wealth that we have given to this system to make sure that we have proper access to healthcare. We're at a point now where, bureaucrats don't usually talk politics. They don't get involved in challenging the norm of the current elected government. But when you have astute bureaucrats such as Janice Baker, the ex-CEO of Peel Region, the guiding hand of smart decision making, I'm sure a lot of people here know the work that Ms. Baker has done. And if she's vehemently against it, based on the sole fact that what the system we have created here is beneficial, the reason why this region was made was to share the cost and have a system that is effective. If that system is completely dismantled and we're duplicating services, how is that fixing the problem of equitable care, timely access care? This government on 2 terms has dangled this carrot of we're going to fix your problems, trust us. And unfortunately, the progressive, the ones that believe in the public trust, that believe in, publicly funded services, those individuals have not come out to the ballot box to the same extent to those that understand that privateering public funds and public infrastructure is beneficial to us. So that's my one request at all levels of government. If you do have the ability to vote, that is a really important role. But there's another part, which is to speak to your government quite regularly, all levels of government. And if my colleague here pointed an email that you can reach out to tell the board that's going to decide what the dissolution looks like. Again, a non-democratic process. They weren't elected officials. We didn't have a vote to see if this is what the residents of Peel want. This was just thrown to us saying, higher level of government wants this done, we're going to do it. And for the most part, people are just waiting for a resolution. They're not even trying to understand the legalities around it. Every year, your government asks you to participate in their budget consultations. And I remember hosting a town hall much like this one a couple of years back and asking residents of Brampton to talk about the healthcare crisis. And we had 3 specific asks at that time. Phase 2 funding of Peel Memorial, a hospital land allocation for the city government to allocate land for a 3rd site for a hospital, and to make the funding as par per capita for the Central West Lynn, which was at that time the bureaucratic way of getting public funds to different municipalities that would fund our public healthcare system in Brampton and Caledon. They dangled a 2nd hospital, but it's already delayed by 1 year in construction. We don't know for a fact if we're going to have CT and MRI at the new Peel Memorial Hospital. But they're dangling the carrot and we're saying, oh, they're going to do it, let's not rock the boat too much. This will happen for us. We're already seeing a delay. And this is the fundamental issue that we're having is they know we desperately need to match the capacity and service levels that we need for future generations, current generations that are accessing healthcare. But we aren't organized in a systemic way to let them know like, hey, local government, please allocate land. Provincial MPPs, whether I voted for you or not, you're my elected representative, please explain to me how this Peel dissolution is serving my best interests. It's just having conversations. We go so much to our partisan lens, we forget that the elected government has a responsibility for you, whether you have elected them or not. And that's why I ask everyone here to participate in your local budget consultations, whether it's in Mississauga, whether it's in Brampton, whether it's on the provincial level or the federal level.
educate us even further on the privatization of healthcare in Ontario. Thank you.
Thank you. What a crowd. Yes. I feel like a stand-up comedian. No. So first thing, Jim, is I'm changing the agenda a little bit. I was going to do a PowerPoint. Screw that. I'm going to start talking about some hope. Because I got a lot of hope on this, and I hopefully will inspire us all because we are not alone in this fight. And I will be very conscious of the time, but also hopefully leaving us all with something to do. So first off, I work for Unifor National. My name is Josh, but I also work with at least 5 on a daily basis, other healthcare unions and other unions in healthcare and other members who deeply care about healthcare. And this is my first point of hope. We were inspired, frankly, at least myself personally, by the great groundswell of support that actually beat back Doug Ford on that big other thing that affects this region that we can learn a lot of lessons from. And I'm talking about the Greenbelt. Yes. Who here was active in the Greenbelt fight back? I saw you clapping. Yes. So why am I bringing up the Greenbelt when we're talking about healthcare? Because it's proof that you can beat Doug Ford, and you can even beat him on huge, huge issues that he thinks, when he's starting on the project, he will never reverse on. But Doug Ford reversed on the Greenbelt, and we have to keep the pressure on him. We believe as Unifor and all the other unions that we can reverse him on this entire privatization thing. And he's going to say no all the way to the very end until he says yes. But we are inspired by the groundswell of community support around things like that give us a path in which we can choose. And this is the path. And this is what we're doing in Unifor and many other unions. In a historical way, we literally have never done this before in Unifor. We have 130,000 members in Ontario, right? So 130,000 voters, right? Just as you're saying, we're actually live telephone calling with our own members, each and every single one of them, about healthcare and only healthcare. Normally we call them during elections for sure. Normally we try to get certain people elected for sure. But nope, just like the brother was saying, we are stopping all that, and right now we're calling every single member and making sure that they know what's actually going on broadly across the province, but also specifically when they're within their own specific area. You mentioned the North, for example, a whole different set of issues in the North, but the North is also talking about Peel, right, and what exactly is happening to you here, right? So we are calling every single member, and you would not believe the results we're getting. I believe you two will absolutely agree with me on this. You know, almost every single member is understanding that America is what's next when it comes to healthcare. If we go down the Doug Ford route, is understanding the risks and the consequences. Many, many people, unfortunately, have their own personal stories. We're hearing a lot of personal stories. But we are absolutely overjoyed with the amount of support that we as a union have and that we as a civil society have in winning this issue. So that's just one union, but almost every other union is doing that. This is one of these issues that just sparked a bit of a mini revolution here. So I'm encouraging us all to be very hopeful about that and make sure you talk to your neighbors that this is one of those issues that we can absolutely win on. And I have 2 other examples for you, right, before I can do this all day long, but healthcare is one of these issues. Manitoba. Why the heck am I talking about Manitoba? Okay, we just had a provincial election there. Premier Wap Kinew won the election after 13 years of progressive conservative rule. Please give a clap out for Premier Wap Kinew. Thank you. All right. I was there. We had many other Unifor members there. Many other activists were there. We went into that election thinking that we were going to be fighting about the environment, about inflation, about education, about landfills, Indigenous rights, all very, very important things. But the number one issue that made sure that Wap Kinew beat Premier Heather Stephenson was her plan to privatize hospitals in Manitoba. All the other issues mattered. There are some people that voted for that. But at the end of the day, especially in the last 2 weeks of that provincial election, it was all about her plan to further privatize, reduce. She closed 3 ERs, if you can believe it, even though the population is growing. It was all about healthcare in the end, and the NDP had a great plan, thank God. They had it all lined up, everything was fine, great. But we could not believe what an emotional issue that was, and what an issue it was that affected voters and made sure they got out to the polls. Because as we know in elections, half the chore is not persuasion. Most of the chore is turnout, turnout, turnout. and in that election, we turned out because of healthcare. So we are taking our big lessons from the Manitoba election around healthcare, and we're going to apply it here in Ontario as well. And no, you can't start too soon, right? You can't too soon. Two other provinces where this whole debate is going on right now that also give us great hope, give me great hope. One is British Columbia. So in British Columbia, they have an expression there that you can't shrink to greatness, which really applies to Peel, by the way. I don't know what we're doing here in Peel. I live in downtown Toronto, forgive me, I'm sorry, I live in downtown Toronto. You know, where the home of the Fords, right? I got the Fords, I'm sorry about that, right?
No, they live in Etobicoke.
Yeah, what was that?
They live in Etobicoke.
They live in Etobicoke. Okay, I'm giving the broad Toronto brother, thank you, you're correcting me in my, oh my God. Listen, you know, what we absolutely know in all these regions, right, is that all these healthcare issues are from downtown to the suburbs, to Oakville, where we are in 2 nights holding a town hall like this, to London tomorrow night where we're holding a similar town hall. They're absolutely touching on every single one of them, and it gives me hope. Sorry? Somebody's on the mic, I'm going to ignore that. One more sign of inspiration and hope. Nova Scotia. Anybody here got any relatives in Nova Scotia? You got relatives in Nova Scotia. Leon Rideout, former president of Local 1285, has relatives in Nova Scotia. There is a progressive conservative premier there who we have a lot of difficulty with, but he got elected, my paramedic friend. He got elected because he promised to improve in a public way paramedic services. It's bizarre. The Liberal government there was the one that was threatening paramedics, but nobody could win with that. And so the Conservatives went pro-paramedic, pro-public health care, and actually is truly improving ambulance services and response times and staffing levels in the province of Nova Scotia, because there too, this is 2 years ago, they were voting on health care. So all this to say, that we think we got an issue here that is on fire, and all of us as unions, so long as we do our job, it's really up to us in a lot of ways. That's my big internal push, right? So long as we can get people engaged on the issue, we know we can turn this around starting now for the next election. So are you all going to help us with that?
Yeah.
Yes. All right. But I know we're amongst friends here. I'm looking at a lot of old friends and some young friends as well. I didn't mean to call you all old, Ken. Right. But I'm telling you, friends, we're doing lots of polling. We got this, man. We can totally win this. We got to keep up these fantastic meetings. Thank you. We got to keep hopeful. We got to name these provinces where we're winning on healthcare, and we got to absolutely never forget the Greenbelt, because listen, if he's turning around on his developer friends, he will turn around on this. I'm totally determined. Thank you very much.
Josh, thanks so much for that, because we just can't dwell on the negative. We have to be able to look at the positive. Because when you look at the fight that's happening in many provinces across the country to stop the privatization of healthcare, this is something that is critical for the working people of this country, but not just for the working people, but for everyone. This will be one of the biggest fights that we've seen in the country, where private interests that are basically based out of the US see our healthcare as nothing but a cash cow. And we have to keep in mind that when the Ford government is pushing for privatization, what does that mean? Well, I have a friend, and this is a very, I don't want to keep on the negative, but he has family in Michigan. And he was telling me that one of the things that's not spoken about in the US is the suicide rate for people who cannot afford health care. And it's one of the leading causes of mental health and of suicide in the US is not being able to access health care in a timely manner. But saying that, we have to fight. This is not something that is a final destination. This has to be viewed as a constant push, because certain interests in this country have been pushing at this since the creation of public health care. And we have to keep on pushing back, because that's the only way we're going to win. But saying that, it is I apologize for being so late for having the mic open. But let me ask you a question. Who in this room has spent upwards of 8 hours at the hospital waiting for service? Put up your hands. I'm one of them. And I'll give you my story. A personal story. I had a slip at work. I smashed my ribs into a guardrail, and I didn't know if I had broken my ribs or if I just badly bruised them. Went to there's a station at the plant, and I work at the Stellantis facility. And the nurse said, I said to the nurse, I need to know if I had broken ribs or if I really just badly bruised. So they sent me to the hospital. I was standing in the hallway for 6 hours before I saw anyone. The hallways were jammed packed. Not just people were standing, but people on stretchers, people on gurneys, waiting to be seen by a doctor.
Hallway healthcare.
Hallway healthcare. People were screaming in pain, and they couldn't even get an injection of a painkiller or being given a painkiller. It took me 6 hours to see a doctor. It took me another 4 hours to get x-rays, and it took me another 2 hours to get the results. And I was standing the entire time in the hallway.
Okay.
I was lucky that they were only badly bruised, because if they were broken, who knows what the situation would have been. But this is happening not just to me, but thousands of people in Brampton on a regular basis. So please, come to the mic. Tell us what you're experiencing. Because the only way we can solve the situation and solve the crisis that we're seeing in healthcare is finding out what people are suffering with. And you're in the room, and this is the reason why we're having this meeting, to hear from you. So please come to the mic, if you feel comfortable, and let us know the crisis that you and your families have been seeing. Next, anybody?
I have a few things to say before we start. Hello. I feel so short. So I just wanted to mention before we start, the way that everything is going to work, we have a microphone right there. If you have a personal story to tell, you have a question or a concern or an opinion, you are welcome to come up to the mic. I am here because of my own personal stories, so is there anybody who would like to share right now? And can we check for people on the Zoom? People on the Zoom, please raise your hand. Yes, thank you. You'd like to come? Please come up to the microphone. And if you need a chair, we have a chair beside the microphone that people can sit in, and Sylvia can help you adjust the mic. Yes, please come. Yes. Thank you, everyone.
Well, my name is Shea Chibur, and I'm going to mention something which happened to my husband. He's gone now for 7 years, but what happened to him was very scary. I had a kind of a heart attack myself. He had cancer, and he had some tongue tied, and I was bringing him from Mount Sinai. They had taken it down. On 410, he started bleeding. So I decided, instead of going back to Mount Sinai, I brought him straight to Brampton. I believe I reached here about 5:45. He's bleeding, his clothes are red, everybody is there. And we were in the hospital for almost till 1:30. They were just giving him ice, God, nothing, no doctor. Finally, oh, we are trying ENT, there was no. And my husband was a diabetic patient. Anyways, around 1:30, I got so fed up and I said, do you want me to take him back to Mount Sinai? Guess what their answer was?
Yes.
Do you mind?
Shame.
And I was like, okay, I have been in the Mount Sinai since 8 o'clock in the morning. All his treatments, I brought him 1:30, I'm taking him back on the highway. scared, he's a diabetic. And these guys had no courtesy to send me in the ambulance or even call the hospital. By the time I reached Mount Sinai, they closed their emergency and you had to go from the other side. I had to basically park at my car. Carrying, my husband was a tall man, about 6 feet. Of course, he was weak, but still, it wasn't physical. Anyways, I carried him almost, we dragged him to the Mount Sinai. One look at him and they said, what happened? Explained to them. They said, and they had no courtesy to even call us? What kind of a hospital is that? They took him right inside, and you wouldn't believe it, he went to the diabetic shop. The doctor was at the airport, they were going from a conference to Vancouver. He came from the airport, right running there, he looked at him, and he was about to kind of administer something. In the meantime, my husband was just in a, kind of a shock or coma, whatever you call it. The nurse came running and she just pushed the doctor away and she said, I know what I have to do with him. She put him somehow, I think he made him lie down or can't even think straight away. And they gave him some kind of I believe, needle or injection, and he was there lying down, totally gone case. And then after that, when he came back, the doctor stayed with him. He did not leave till 6. He says, I'll wait till the next doctor comes and then I'll go for my conference. And they were kind of totally, and this didn't happen only once. I had lots of experiences with my husband like that in this hospital. So this is one of the major ones which I thought that this is how it was. And when he had a cardiac arrest, the doctor had the gall to tell me, oh, he's gone. I'm not going to waste my resources on him. What do you want to do with him? This is the doctor at this thing. And my husband, I said, he's not gone. I don't want you to waste your resources. I want you to leave the oxygen on him and the IV. And my husband survived 4 months after that. And this is what he's telling me. And he's getting mad at me, telling me, he had the gall to say, didn't the big guys tell you what is wrong with him? I'm not going to waste my resources on him. Do you want me to put him in the ward or leave him here? Excuse me, you are a doctor, you are an emergency doctor. This is a trauma treatment you do with this? What kind of a doctor you are trained? I said, my father was a doctor and I know how the doctors treat the patients. This is not how they treat the patient, especially in this situation. And this is what is happening at the Brampton Hospital. So, sorry, I shared 2 of those experiences, but I really had no good experience with this hospital. Thank you.
I'm so sorry to hear what you've experienced and what your family's experienced. But sadly, many families are experiencing the exact same thing. Would anybody like to comment?
Shay, thanks for sharing. Also, I first met Shay, I think, 13 or 14 years ago, and I haven't seen you since, so it's good to see you again. I think one of the sort of unspoken problems with overload in healthcare that we definitely see in Brampton Civic, keep in mind, Brampton Civic Hospital sees more patients daily than any other emergency department in the country, and it isn't staffed for it. Is that the providers who work in there are people, and they suffer compassion fatigue, they suffer from moral injury, and they develop very hard shells, and you can only do things beyond your limit for so long before you start to make mistakes. One of, in my opinion, the best physicians in Brampton Civic was just the subject of a lawsuit that he lost because he was found to be negligent. We are all human, and ultimately, when you continue to demand so much of these people, and they have such a flow of patients coming in and they're trying to hold off the onslaught, mistakes happen, attitudes develop, and that's the danger of having an understaffed healthcare system. That's the danger of not having 4 hospitals in a city that definitely needs it. That's the danger of continuing to operate beyond what the system was designed for. So thank you for sharing. It's such a sad story. I'm so sorry.
Sorry, me kind of comment.
Thank you again for sharing that story. I think it encapsulates a lot of what, as my colleague here pointed out, compassion fatigue is the thing that happens. But more importantly, the one missing piece here in this whole dynamic is the hospital not being present in places like this and hearing these stories. The PR strategy that they have is, building resilience within their own workforce and Osler Strong and all of the messaging that they give and free lunches, free food, whatever to give the extra boost of, the happy hormones for people to work. But what we're neglecting is structural difficulties that aren't addressed. So I really wish next time around when this happens, we have somebody from William Osler present here, and we have their CEO current, Frank Martino. Have a conversation with people that have access to care, right? And I think that's what we need to hear. The decision makers that are trying to change something, this is where your human argument comes in play. Where the numbers that they are trying to stretch, at some point, they need to hear this. That's not in the form of an email, and that interaction solidified that for me, so thank you for sharing that.
My name is Rose Biot. I'm one of the statistics. Sorry, I'm trying not to cry. I've worked in healthcare for the last 20 years. Part of the union, one of the busiest emergency departments in the province of Ontario. The last 12 years I've worked in emergency. I thought I would retire in healthcare. Just listening to the stories is overwhelming. The dignity is gone from healthcare. The reasons why we got into healthcare are just not present. The dignity's gone. There's not that time to spend the extra 2 minutes to talk to a family member, to take a call. And it hurts, right? When David was talking about moral injury, when you see bad things happen to good people. You can only handle that so much as a person and a human yourself, and seeing the dehumanizing that has happened in healthcare is really, it's very disheartening. And although I'm not from the Peel region, all of our issues are exactly the same. David, you talk about the decrease in paramedics in the service. We've had that problem too. Hearing a code 0 come over the radio is absolutely overwhelming. A code 0 is when there's no ambulances left in a region or a service, and the person calling 911 needs to wait for either someone to be offloaded into the hospital or an ambulance to come from another region. And the things that we see are just beyond what we would ever expect and what would be expected of us to work in healthcare or any public service. I just want to say thank you. Thank you to those that have stayed in healthcare. I understand why you stay, and I understand why we don't too. It's hard, so tough seeing some of your friends and family that you've worked with for decades leaving something that they treasured so dearly and have kept so close to their heart.
We were unfortunately not able to capture everything on video due to technical issues, but we had several more very moving community testimonials at the town hall. Please send us an email at info@bramptoncaledonhc.ca if you would like to submit a testimonial video or be interviewed on your experiences in Brampton or Caledon healthcare. Use hashtag BRCHC Town Hall, hashtag Brampton Health Stories, and hashtag Caledon Health Stories, and tag us if you post your story on social media. In conclusion, thank you for your stories. We deeply appreciate everyone who told their very personal, very difficult testimonials at our town hall, whether we were able to capture them on video or not. It was a very emotional and motivating experience, and we know now more than ever what we have to do. Gathering together and telling our stories is the only way we will impress upon the public and the establishment the urgency of this healthcare crisis in Brampton and Caledon. How you can help. The most important thing now is to take what we have learned, show it to those who represent us, and make them take action. Go to bramptoncaledonhc.ca/act and find an action that suits you. We have actions as small as following us on social media or as involved as volunteering or collaborating with us. You can help in person or virtually with any level of expertise or experience. You can help with any level of capacity in this hectic time. You can even donate if you don't have the time to volunteer. As we grow, we are especially looking for volunteers to help us with social media and tech, leafleting, phone calls, making community connections, sharing testimonials, coming to events, and planning and organizing. Even just educating yourself on the issues helps. We will soon be posting an interactive action quiz to see what action best suits you, your interests, and your capacity. Our biggest action right now, as governments develop their 2024 budgets, is our pre-written email to your government representatives. It describes the issues facing Brampton and Caledon in healthcare and contains the following demands. As a resident, I demand stop privatization. There needs to be a moratorium on private hospitals and clinics opening and an integrity commissioner investigation into healthcare privatization. Increase public healthcare funding. We need adequate funding of public healthcare, including Ontario spending its whole healthcare budget and on public healthcare, increasing that healthcare budget to the Canadian average, and increasing wages to public healthcare workers in line with inflation. Healthcare for all. The immediate reinstatement of physician and hospital services for uninsured persons program, PHUP, and a committee to expand eligibility of OHIP to all Ontario residents, regardless of immigration status. Improve the Peel Memorial Centre expansion. The Peel Memorial Centre expansion needs double the number of hospital beds from 250 to 500, full testing and surgical capacity, and to make those beds available to ER patients. More hospital beds per capita. To get Brampton and Caledon to the Canadian average for hospital beds to population by the allocation of land and funding for our third hospital and immediately starting to plan and build its fourth and fifth hospitals to keep up with population growth. These hospitals must be publicly run, not P3 hospitals, have emergency rooms, fully equipped operating rooms, adequate testing facilities, and overnight beds. Check out our website, bramptoncaledonhc.ca. To learn about local and provincial healthcare issues, take action to protect and improve public healthcare, and connect with us, or email us at info@bramptoncaledonhc.ca. Thank you to our community partners at the Town Hall. A special thank you to our co-hosts, Unifor and Peel Regional Labour Council. We are so grateful for your collaboration. And our mother organization, Ontario Health Coalition. We couldn't be here without you. Plus, our guests, Roots Community Services, Moyo Health and Community Services, Punjabi Community Health Services, Mississauga Health Coalition, Labour Community Services of Peel, Justice for Truck Drivers, Peel Paramedics, OPSU CEFPO 277, Decent Work and Health Network, Healthcare for All Coalition, Workers' Health and Safety Center, Brampton Action Committee, Neurokin, Community Climate Council, and the David Suzuki Foundation. We deeply appreciate the collaboration and support of our community partners, and we hope to see you again soon and support your next action. Thank you to Peel Elementary Teachers Local, ETFO, and Peel Regional Labour Council for their generous donations. If anyone else is interested in financially supporting us, please send us an email. Follow us on social media at the link in our description, bramptoncaledonhc.ca. We have Twitter, a Facebook page, a Facebook group, Instagram, TikTok, and YouTube. You can also join our email list, email us and request to join our WhatsApp chat, book a phone call, and more. Please share this video with hashtag BRCHC Town Hall, hashtag Brampton Health Stories, and hashtag Caledon Health Stories, and tag us in your healthcare testimonials. Comment on this video with your story, subscribe to see more of our videos, and like this video to help us get the message out.